Hello, and thank you for joining us. This is Health Matters on Channels Television. I am Mary Alale Yusuf. The global count of confirmed COVID-19 cases is now over 219 million. And as at Friday, September the 3rd, the death toll was over 4.5 million. In Nigeria, there were more than 194,000 confirmed cases of COVID-19, more than 179,000 recoveries, and 2,495 deaths. Recovery rate is about 92.6%. Case fatality is about 1.3%. Tested samples are over 2.7 million. For many, this is the first experience of one disease spreading all over the world at the same time. According to the World Health Organization, COVID-19 has affected over 200 countries and territories. It has also been the fastest race for vaccines ever, resulting in several viable options around the world. So far, more than 5 billion vaccines have been administered worldwide. Evidence of being vaccinated is now a passport to enjoy some things others may not be able to. Yet, there's still a lot to learn as different vaccines are shot and the SARS-CoV-2 virus evolves. My guest is a consultant public health physician and a chief research fellow at the Nigerian Institute of Medical Research. We have Dr. David Oladile on the show. You're welcome to the show.
Thank you very much for having me.
Great to have you on the show.
Thank you.
Okay, so let's start with something that has been making a lot of, giving us a lot of question marks. There are rumors that in other countries, vaccines are being mixed. You know, like I took AstraZeneca the first time and Moderna is available. Maybe I just take it the second time and just have it done with. Are these rumors true?
Well, available evidence from the World Health Organization shows that there's some research going on to find out whether you can actually mix these vaccines. So as of today, it is not recommended. I think University of Oxford, they do some research to see whether if you've taken the first vaccine, maybe AstraZeneca, you could try to do Pfizer vaccine later. But data from that study is still being awaited. So it is not yet a recommendation, as it were. Okay. For some reason, because they use different mechanism of action. And
well, Pfizer and Moderna have similar technology, you know, sending a message. They are messenger RNA vaccines. Yeah. So maybe that's a pointer. And then J&J and AstraZeneca also seem to be similar with the adenovirus technique. Yeah. But anyway, when it happens,
it's not recommended.
It's not recommended.
Yes.
What's WHO saying?
Well, from just last month, it was said that when the data is available, and that is one thing I like to stress on this program, WHO is based on evidence-based practice, meaning that before they can make any recommendation, they will have looked at different evidences from clinical trials, especially compare one or two, then look at the result. So does it confer the necessary immunity? Is it safe? Does it do what it's supposed to do? Efficacy and effectiveness. No, if they have data to support that, then there might be a recommendation. But as of today, it shouldn't happen. And again, they quickly stated that if it must take place, it must be the decision of the public health agency of that country.
A high-powered decision.
Yes. So it is not to be taken by someone on the street that, okay, had Pfizer, I want to try Moderna. No, it should be a regulated process decision, by the public health, like Nigerian Ministry of Health or the National Primary Care Development Agency, to decide to do that. So in Nigeria today, we don't mix vaccines. So if you're taking AstraZeneca first dose, now we have stock to take the second dose, so you should get that.
Which brings me to the second question.
Yes.
Some people say that they took the first dose of AstraZeneca and their window of 12 weeks is over. Are they going to start all over again, or is there some window we haven't seen? Can they take a second vaccine?
Even if it's over, it won't be that, the gap won't be that much, actually. That's because I know I got my first dose around April, second dose 12 weeks later. So, and those who have taken first dose actually took their first dose about July or thereabout.
Some people took their first dose long after, you know. because there was hesitancy in the beginning.
Okay, so they are not taking second dose because they intentionally didn't take it, not that they missed their appointment, or it wasn't available.
Possibly.
Okay.
But we do know that there are a few people like that who are saying, oh, my 12 weeks is over. What's going to happen to me?
I think now that we have a stock, they should just go ahead and approach the vaccination center, and they will advise accordingly. But I think they can still take their second dose. Maybe
something like, the expiry date of some goods. They give you the 12th, but it doesn't mean that by the 16th you can't still use it.
I think there's a window of opportunities. I mean, of the duration. It's 12 weeks, but it can extend a bit longer. Okay. So it's going to be on a case-by-case basis.
Okay.
Now, what am I saying? That somebody who took the first dose maybe earlier in the year, like April, and because of vaccine regret now, because there's vaccine hesitancy, meaning that they don't want to take it, vaccine regret that I've taken the first dose,
and it did me bad.
I don't want to try it again.
I don't want to go back there.
So that case will be evaluated on case-by-case basis, and they'll be advised on what should be done.
All right, then. Thank you. I'm concerned about records.
Okay.
So we're going to have several vaccines being shot in Nigeria. Some are taking AstraZeneca, some are taking Moderna. We hear that the J&J will soon be administered. How are we keeping these records straight? Will you know, for example, if you are an officer who needs to verify at a glance, and somebody comes before you, that this person took such and such a vaccine on such a date, has finished or is yet to take his second dose at a glance?
Yes, I want to commend the National Primary Care Development Agency for doing a great job with regard to vaccine logistics. When you are vaccinated, I'm sure you've had your first dose, you were given a card.
That's correct.
And there's a barcode on that card. Now, when that barcode is scanned, it's going to produce every information that needed to be known.
Okay, everything comes out.
Comes out.
Oh, that's good.
So it's thoroughly monitored from the supply to the point of administering it. So with that, they can actually get the data. So I think with regard to data management, I think we got it right this time around.
That's
and
good.
Kudos to
Let's take it a bit further.
Okay.
Now, this is the case now because we have a global disease.
Yeah.
Are we going to do something about putting data on those barcodes or that database for vaccines like yellow fever that has given us a lot of trouble with other countries, for vaccines like polio, and all those EPI vaccines? Will we be able to load these things on the database and have all that information at a glance, that Mr. X took all his EPI vaccines from when he was born, and he has taken his COVID-19 vaccine, and he took AstraZeneca on so-so date? Will that be able to jump out at you with this new system that we have?
Well, I don't work in the agency, so I'm not too sure. I don't want to preempt.
But it could be
ideal. It might be a bit challenging.
Tricky.
Because they're on two different platforms. There's a platform for the COVID-19 vaccination, which is not the same as what we use for NPI, for the routine vaccinations. So it's going to be difficult to actually have the record of child immunization on the COVID. It's a entirely different system. And to talk about yellow fever, I'm sure there's an electronic yellow fever card that Nigeria Post Health brought out some years back.
Okay.
So I think that is so it can actually be scanned when you are traveling and to know whether you actually be vaccinated or not.
Because it's a bit difficult bringing out several cards, just for vaccination.
Like you have one for all.
Challenging,
okay.
Yes.
All
one
right.
that covers everything.
Yeah.
Some people can't find their child's card. I can tell you that for free. I think it was a green card. Then there was one that was a brown, like a cardboard thing.
A picture of a child.
With a picture of a child growing up inside, and you fold it like that 3 ways. Yeah. It's not everybody who has that card anymore.
It's not electronic.
And that card doesn't have a barcode on it. So there you go.
Maybe that would be the next thing to be done. And I'm sure they are listening. It's actually been nice to have that computerized, actually, so we can have a database that have all these things we're trying to do.
Okay, so some days ago, it was the state of Vermont in America that had just 28 COVID-19 patients. I'm reading the information here. And they also had the highest vaccination rate. So there's some merit to saying that the more you vaccinate people, the less the disease, right? Yeah. So what hope is there now for countries like Nigeria that has done only 1% or just over 1%, vaccination exercise, what hope is there for them? If we could vaccinate fast and people would respond fast, I'm sure we'd be right up there. But it's not possible for every country. So what is to be done? We want to bring our numbers down to maybe even less than 28. What do you see in the future for such countries?
Well, I'm sure WHO is aware of this. That's why they brought COVAX on board to see how they can actually help countries in Africa to have access to vaccine. The issue of vaccine is a lot of factors. The first thing is access.
Access.
Now, in African country, I'm not sure any country is manufacturing vaccine. I heard recently that they want to start manufacturing this vaccine in South Africa. But in Nigeria, we don't. We have not produced. We don't manufacture. So we have to depend on what is given to us COVAX, and I'm sure Nigeria government tried to procure some through African Union. That is the Johnson vaccine and some other. So for us to actually have enough vaccine that will take out the public, it will take some time.
And while we are taking time,
yes, so that's why the
people
next
are
thing
getting
we need,
sick.
Yes, I agree with you. What we need to do next is to go back to what we know work, the non-pharmaceutical interventions, which most people in Nigeria, as like we've to use the word on the street, we've ditched it. We don't do it any longer.
Yes, it has been ditched.
So
I can tell you.
It's a lot of concern.
We need a whole new campaign for that.
So we need to do that. You see parties, people go without wearing face mask. Social distancing does not occur any longer. Hand washing is not being practiced the way it should be practiced. Now, this is what we did with the first wave and second wave that we were able to get to where we are. So I think since we don't have access to this vaccine, not talking about the vaccine hesitancy that is strongly there based on so many factors, including wrong information on social media and all the rest. So I think there's a need for government at national and subnational level to reject or to reenact all the effort towards the non-pharmaceutical intervention. We need to make more noise about it.
While we wait for vaccines.
Yes.
Hopefully.
So that needs to be done.
All right.
Yeah.
Some people are stating their right to not to be vaccinated as an individual. Like some people just come up and say, I don't want the vaccine. Yeah. And the executive director of MPHCDA is saying, you have a right to decide whether you want to be vaccinated or not. But your right stops at the point where you begin to endanger somebody else. Now, that may look like, okay, so there's still hope for me to say I should go without the vaccine. But I want you to pinpoint for us, where is that point where that right begins to encroach on somebody else's safety?
Just to mention some of the things to support the statement I just quoted, I'm aware that some countries are trying to make vaccine mandatory for their citizens, especially in Europe, despite a lot of outcry against vaccination. And I'm aware that even some country in the West, for you to enter their country, you must come with a vaccine card. For you to be able to go to school, you must have some of these things because they feel that there's a need to be able to protect the entire population. Now, if vaccine is available and someone chooses not to be vaccinated, at that point, that is the point that the director is talking about.
That's where he begins to endanger someone else.
Now, WHO has a policy statement that came out in April about making vaccine mandatory or not. And there's some criteria that they clearly stated. Number one, when the disease is of utmost importance, there's danger to people. Number two, when the vaccine to be used is efficacious, is effective, and it's safe.
And
Number
it's
three,
available.
when there's access, that's availability. Okay. Number four, when there's public trust. And the last one, when ethical principle has been obeyed. So these are the things that need to be looked at before you can actually say vaccine is mandatory for the population. Okay. So if there's access and someone decides not to be vaccinated, then the country at national subnational level can actually bring up policy that you will not be able to access this service. Not that you'll be thrown to jail, no. There'll be restrictions on services. You will not be able to do this if you are not be vaccinated. Like US, I heard that said about US, if you don't get vaccinated, you can't travel you will not be allowed at the point of entry. Some country might decide to do that. Some state might decide to do that.
Okay, so for us, availability is what we're waiting for. Access,
yeah, access,
and then we can get into that. We do have to go on a break now.
Okay.
Please stay with us. We're going on a short break. We'll be right back. Welcome back. It's Health Matters on Channels Television, and we're discussing vaccine administration with Dr. Oladele. You can call 0808-054-2233 if you have a question on vaccine administration. Dr. Oladele, for now, pregnant women are not being vaccinated in Nigeria. Is it the same thing everywhere else in the world?
Yes. According to WHO guideline, you can only vaccinate when the benefit outweigh the risk. Because there's limited evidence of the safety of this vaccine.
What is the risk to a pregnant woman? Because a pregnant woman is already taking tetanus toxoid, you know, to protect her child. So what is this risk we're trying to avoid? The
risk is we don't know how the vaccine will work with pregnancy. Okay, there's no evidence. Like I told you, WHO is evidence-based. Now, when benefit outweigh the risk, it simply means that the pregnant woman is at increased risk of getting infected, probably because of her exposure, where she lives, and things like that. Then you could consider it. But as of today, it's not being given for pregnant women.
Increased risk of getting infected?
Yeah.
All the more reason why she should be protected.
But not everybody at increased risk of getting infected. So for those who have that increased risk, then you can say, okay, the benefit of being vaccinated at that point outweigh the safety issue.
Can we then say that if a pregnant woman had to travel, she would get the vaccination?
There's no clear-cut guideline on whether they need to get vaccinated.
So that's just a gray area for now?
It is.
Wow. Okay, then let's go to our children.
Okay.
It may not be so in other countries, but in Nigeria, our children are a major
population.
A major, percentage of our population. We're talking about people 17 and under. It's huge. Yeah. So even if we were to have enough vaccines for everybody, and we didn't vaccinate people 17 and under, we are not really right there. We can't really say we've got herd immunity.
Yeah.
With the percentage difference. So what are we doing about that? I mean, some other countries are already vaccinating their children 12 and above.
Yes, with regard to children and vaccine, the one we have in it, we have 3 vaccines now. We have the AstraZeneca vaccine, we have the Moderna, and also Johnson &
J&J.
So the 3 of them, they are not being given for any child less than 18 years.
Anywhere in the world?
Anywhere in the world. The record I saw from CDC is Pfizer could be given for those between 12 and 17 years. But we don't have vaccine in Nigeria. So that is why, and if you check the guideline from the regulatory agency in Nigeria, it's recommended it for those from 18 years and above. And that would be about 112 million population of Nigeria that need to be vaccinated.
Okay.
And we're still trying to see.
Not bad, but not quite there.
We're not quite, And until you get, like you said, we are just doing around 1%. Some countries have done about 80%. So until you get to that level, we can't talk about herd immunity, so we still have some way to go. That's why it's very critical that we stick with what we know help, the non-pharmaceutical intervention to protect us from the spread of the virus.
Okay, let's take Greg who is calling from Lagos on the phone. Hello, Greg.
Yeah, good afternoon, madam.
Good afternoon. What's your question?
Okay. The question I want to ask is, a lot of questions, but what I just want to ask is, within situation, those who have taken the 2 jabs, they still contacted the coronavirus, and it's not as if they just contacted it, but it didn't really weaken them, and they were down. I met one who said after 2 weeks of treatment, that the I think cough wasn't still clear on it. And there was a particular one too that was still on oxygen. Somebody who took the 2 jabs. So if they say somebody should take the second jab and it's still not protecting you, but at least it should not bring it down. That's my question.
Right. Thank you, Greg. That's a very valid point. He's talking about somebody who has been fully vaccinated, coming down with the disease, and not just coming down, but needing oxygen. What do you say to that?
Well, it's unfortunate, but it does happen. We call that breakthrough cases. Now, as a mother,
cases. Do we have many of those?
Yeah, we do. But as a mother, I just want to underscore the point. It's not new. You must have heard about the child who had full childhood vaccination coming down with measles.
That's correct.
That's a breakthrough case. So it happens, all right? And the reason why that happens is because we have new variants coming up, okay? But what we know about the vaccine is mostly meant to prevent severe disease, hospitalization, and death. So in other words, for those who get infected, they won't have severe disease. For those who have severe disease, they might not be hospitalized. For those who are even hospitalized, they will not die in the process.
Okay, so
it's a spectrum.
Overall, it does make you better.
Yeah,
Let's quickly take Austin. Hello, Austin. What's your question?
Hello.
Hello, Austin. What's your question?
Yeah, my question is this. Yeah, my question. Why is it that if the vaccine is really effective, why is it that it cannot protect those who have taken it from those who have not taken it? Why are they talking about risk from those who have not taken it? So that is my question.
All right then, Austin. Risk. What's the risk like for somebody who has taken it and someone who has not taken it? Austin is not convinced that the vaccine protects because we still talk about risks to those who have taken, risks to those who have not taken the vaccine.
I think we need to know this. And I was talking to a friend over the weekend or during the week about the issue of taking vaccine. Taking vaccine does not mean that you need to throw away all the non-pharmaceutical intervention. Vaccine is another arsenal or is another tool in the fight against COVID-19. That's the fact we have to know. We are dealing with a novel disease that's a lot of unknown issues. We have new variants coming up on a daily basis. And so this could affect how we respond. And we have idiosyncrasy, the way our body develop antibodies in different ways. So there's many factors that we don't know. But what we do know is that the vaccine does protect severe disease. It does protect against hospitalization. It also protects against death. Okay? So it's possible that you can still have breakthrough cases.
Okay.
In place where I work, we were monitoring, I oversee the team that's monitoring breakthrough cases. I had about 3 or 4 people, but they all have mild illnesses. Some of them started converters a few days. So it can still occur.
But it's better.
It's better.
That's good to hear.
So we need to know that.
Let's talk to Abdul Fatai, who's calling from Edo State. Hello, Abdul Fatai.
Good afternoon, madam.
Good afternoon.
Yeah, I quickly want to chip in this. Our pharmaceutical industry, I think they are failing in this. Other countries are manufacturing their vaccine. What is happening to our pharmaceutical industry in Nigeria? Don't we have people who can carry out research, from other countries that are already producing? Don't think it's necessary, and rather than just depending on other countries to get vaccine from them. So
thank you, Abdul Fatai.
Right.
Fortunately, we have somebody from Naima. So let me put it to you. How far are we on the search for a vaccine in Nigeria?
Yes, a lot's been done. Naima is currently working on a kind of vaccine, and we are doing preclinical trial in animals to see how this will work.
Ooh, that's a long way off animals.
Yeah.
Okay.
Before you can have an effective vaccine, we need to be educated that you need to have, when you have the molecule, you need to do a preclinical study using animals. Then when you have something that looks like it, then you have to proceed through 4 clinical stages of clinical trial.
Okay.
Phase 1, look at safety. Phase 2, look at whether it is safe or it has some efficacy. Then phase 3, that's when you now test it for efficacy at the larger population. So all these vaccines we have went through that phase, and it takes time to get to
All
that
right.
level. So
So
we
on
have
that
missed.
note, I'll have to stop you. You're on a roll, but the time is up. Thank you so much for coming to the show, Dr. Oladile. It's
Thank
been
you.
wonderful.
Thank
I
you.
still have other things to ask you, so I'm going to invite you back. Thank you so much for being there with us and joining us from your homes and for your calls. Greg, Austin, Abdul Fatai, and all those who are still trying but can't get through because there's no time. Have a wonderful day. I am Mary Alale Yusuf.